to The Beehive, a radio program that works to bring our people's voices on issues and ideas in our communities and from afar, to give us a better understanding on issues from the people's perspective. I'm Sarah Parker. In August, I attended a conference put on by the Institute on Violence, Abuse, and Trauma, IVAT, in San Diego, California. IVAT is an international organization that works to provide resources and trainings to improve the quality of life for individuals by sharing and disseminating information, improving collaborations and networking, conducting research and trainings, assisting with direct professional services, program evaluation, and consulting to promote violence-free living. The conference was attended by people in the medical, criminal justice, social services, educational, and mental health fields, among others. Presenters included people from around the world focusing on social justice issues, basic survival issues, and again, many others. Some of the topics included the neurobiology of trauma and implications for practitioners, marital rape in a global context, promoting bystander intervention and interpersonal violence prevention across the lifespan, shame and powerlessness with complex trauma. To be honest, within 4 days, 110 workshops were offered, along with self-care sessions to support caregivers and give new strategies. I had the chance to interview Mr. Wandimo Yirga. He gave the talk, Female Genital Mutilation, Prevalence, Perceptions, and Effections, Women's Health in Kersa District of Ethiopia, and the Price of Honor, Ending Honor Violence and Abuse in the U.S. This is Mr. Yirga.
So,
can you introduce yourself?
My name is Wandimo Yirga. Originally, I'm from Ethiopia. I have a Master of Science in Public Health, and I'm a nurse. My background is a nurse. I'm based now in Boston, Massachusetts.
Okay. And you work at a hospital?
Yeah, I'm working at skilled nursing facilities, and we have affiliation with the hospitals. Mainly the organization is Genesis Healthcare.
FGM, as defined by the World Health Organization, comprises all procedures involving partial or total removal of the external female genitalia or other injury to female genital organs for non-medical reasons. It has no health benefits and harms girls and women in many ways. Mr. Yirga gave some statistics from the WHO, or the World Health Organization. It's estimated that 200 million girls and women have undergone FGM. He explained that 3 million girls are at risk each year in 30 countries in Africa, the Middle East, and Asia where FGM is concentrated. Although FGM is illegal in the U.S., Mr. Yirga explained that many girls are flown out for a vacation. However, the reason for the international trip is to have the procedure performed. This practice is deeply embedded in culture, and parents do not wish to hurt their children. Rather, they're preparing the girls to be married, with hopes of a good life. Yirga explains that the only way to stop this practice is for men to stop marrying girls who have suffered the practice. Yirga expressed this, but he also clarified that the reality is that this would be traumatic for the girls and women who have already had the procedure done. Men must take a stand on behalf of their daughters and sons now and in the future, teaching them that this is no longer a necessity. The women and girls shouldn't be stigmatized in any way. This is a reality now, but we have the power to change the reality for the future. We're at a conference right now talking about violence, trauma, and abuse, and a lot of different things. So could you talk a little bit about what you do and your relationship to the conference?
Yeah, I was invited. Currently, I'm working with University of Minnesota. They have the Institute of Domestic Violence among African American communities. Professor Oliver Williams, he's working with me on domestic violence and trauma and other related issues. So we have been working since 2015 on that, and we had roundtable community meetings in Minnesota last month, and now we are here in San Diego to present what we are doing. and to get some recommendations and to work together with other company organizations to change community perceptions and some ideologies. I mean, perceptions that has been accepted culturally, or some of the things are accepted like as a norm. So we are trying to bring a change within the communities where we are. And here in San Diego, I brought my presentation on female genital mutilation. As we know, it's a controversial non-medical practice. So the World Health Organization and the UN, they consider it as human rights violation. Having that, I brought my presentation, and my session was on female genital mutilation from different African countries' perspectives, what they believe in, why do they practice that one. So as I'm originally from Ethiopia, some parts of the country still we have female genital mutilation being practiced. And since the US has many immigrants coming from those countries where the practice is being undertaken, so immigrants still they bring their culture and they want to continue practicing this in the United States. So that's the main area of my presentation in here in San Diego. And we are also working together with domestic violence alongside what we are doing on FGM. So yeah, that's
How is your work being taken in the communities?
I'm trying to reach out to communities, like a small group of communities. Still, since I'm working with University of Minnesota affiliation as a consultant, and we gather male and women. So we look at in different way, like males separately, females separately, what they view, what they consider it, how do they practice it, or what do they feel it about it. So after bringing different group of men and women, so we brought both of them together to just openly discuss.
Oh, wow.
So that was actually interesting and interactive. So we had good recommendations. We get like good feedback from those community leaders and community members.
Can you talk more about how that process works, or to what you have come to with the community?
Yeah, mainly what we did is reaching out the leaders, community leaders, from religious groups, from activists. We try to reach the main, focal person that we can talk to them. That's the first starting point, because it would be difficult unless we reach those important for people. Like you have to call imams from Muslims, and Christians, like you have to have Christian leaders or the pastors. We had pastors, so we try to identify those people before we reach out to communities, so that those leaders, they come forward to us and we discuss with them. They take back the recommendations to the communities. So that's what we are still continuing on that.
Okay.
Yeah.
And you're actually working with the victims as well?
Here in the United States, there are actually survivors.
Okay.
There are actually, survivors of.
That's a much better word.
Yeah, we would say survivors.
Yeah.
The victims and survivors, we call it. And
in this conversation, I use the word victim to describe people who have undergone FGM. However, activists and advocates working within sexual assault issues or FGM issues use the term survivor. The use of words gives a different connotation to the event and a different understanding or feeling to the person who had the experience. It also affects how the listener perceives the experience. The word victim implies powerlessness, while survivor implies a reassertion of power. It's important to understand the reason that a person or group chooses to use a certain word. Here, we use the word survivor because these women and activists surrounding the issue are taking back the power by working to inform and change a paradigm that has been deeply embedded in culture for centuries. Again, this is Mr. Yirga.
Of course, I'm not directly involved, but still we are working with organizations working on with survivors, survivors of FGM, survivors of domestic violence and child abuse.
Yes.
So we are still in communication, and we are working with them together.
Okay.
So directly, I'm not involved. Like I'm not engaged directly with survivors, but there are organizations and communities working with survivors.
Okay.
Yeah. Yeah.
Okay. Is there any place that people can get more information, or just is to do anything, or to support this?
The resources we have, mainly we have like IDVAC, as I said, the Institute of Domestic Violence Among African American Community, that was based in Minnesota. I think recently but their website they have their own videos, their own. Currently, we are preparing the videos to be released. All the activities that we have done last July, so we raise the topics, especially domestic violence within the families, among immigrants, especially African immigrants. We focused on them because we have African immigrants coming in, so we are trying to affiliate with especially the Middle East. Currently, Syrian refugees, refugees from Middle East, like Palestinians or whoever comes from that area. We are trying to reach them out through their community leaders. So the resources the IDVAC, it's IDDAAC, that's IDVAC, Institute of Domestic Violence Among African American Community. They can search and they can find those videos, they can download those informations. And the IVET, the one who organized the San Diego conference, they have also all the presentations. So even my presentation will be online, so that everybody can go and access and what's going on, how the things are going there. So it's accessible for free.
Okay.
Yeah.
And I just wanted to ask a little bit more about you said that you had the conversation between the men and the women, and so were some of the women survivors in that conversation?
Women we brought actually those organizations working on them. So working with them, we involved organizations mainly.
Okay.
Persons from different organizations who are focal person who are working with them and speaking to them, who are advocates.
Okay.
Yeah, advocates on them. So survivors, actually we are trying to expand this one, but still there are of course limitations, but we are trying to make it like as a national, like town hall meetings everywhere in every state. So we are trying to, but yeah, we are from different states, we just gather together.
Yeah.
So probably we may try to expand these kind of programs.
Right.
So especially roundtable is very, very nice. They can explain, they can describe in any way. They can use the terms that's actually acceptable by the communities.
Right. Right. It seems like the community, that's so important.
Yes.
Whatever is acceptable for the community.
Yeah. That's why, because they are from their culture, so that they can spread the message back when they go there. So if you take FGM or female genital mutilation, there are countries like where the prevalence is very high, like a country like Somalia. Somalian refugees, they come in here. Sometimes children from the US, they may go back, to undergo the female genital mutilation back home because of the culture. So it's actually difficult to trace those cases.
Because they're sent home.
Sent home.
Okay.
They call it vacation. The vacation is we consider vacation is difficult for daughters and children, small kids, when they are sent out sometimes, So we might design a strategy to address the issue. Culture is here, law is here, punishment is, sentence here. FGM is by law, it's prohibited in the United States. In U.S. soil, whether it's abroad or here, it's by law is prohibited practicing that. harming anyone is not allowed in the United States. But people are still, because of fear of this, sometimes they take them away, so they may stay outside for a while. They bring them back home, but nobody knows what has been done on those girls, young girls. So these are actually issues that we need to more discuss on that. And there was actually, it was celebrated last year, I guess, zero tolerance to FGM. Yeah, President Obama he released a statement on that, and everyone was talking, sharing on social medias and all those things. So apart from that, it needs, I think, national action to come together. Those organizations who are working with different communities, they can come together, and these things has to be stopped. Yeah, but stopping directly is a little bit difficult. It's culture, it's accepted. They say 100 years we have been practicing, so they will say it, but still it needs to be stopped. But change is actually gradual.
So it's only 100 years that they've been practicing that?
I think more than that.
Okay.
More than that, because it came through. I mean, their ancestors were practicing.
So there's an
old tradition.
Yeah.
So mostly the traditional healers, they do it. Some of them they do it for economic purposes.
Yeah.
They want to make some money.
Yeah.
So I can do genital cutting, I can circumcise your girl, can you pay me this?
Yeah.
Yeah. There are too more reasons for that to be practiced. So yeah.
And are there practitioners in the United States? Have they found?
In the U.S. currently, apart from girls who undertaken genital mutilation, the number, they say it's increasing. I just saw it from the website, trust.org. That's the website. I saw that the number in the United States is increasing because of we're accepting more immigrants. But practitioners here, I have no information about that.
Okay.
But because of, as I said, because of laws, because of serious measures that it's a punishment, so they can't do it. They are afraid doing it. So instead, they may go back. So they may be taken to them, and it may be practiced. Yeah. But other countries like if UK, it was being practiced behind doors. So in UK also it's not allowed. In Europe, by law it's not. But what they do is what I saw in a video from the Guardians. The Guardians, they released a video that during vacations, girls, they go back. So for vacation cut. And even one girl who was a victim, she was suggesting that the doctor has to be at the airport to examine kids because she's now adult, but she was recommending that. So to that extent, people are still suffering from that. So it needs integration, working together. So yeah, that's how we can address it together.
And how do you feel like people are responding to the attempted shift in paradigm with this? I mean, do you feel like people are responding well, or do you feel like it's really hard to change culture and change traditions? Or
people, it needs, I think, to analyze the evidence-based practice, whether the people responds in a way that we are looking for, or the goals and the response, community response, has to be assessed well, whether the perceptions and the needs or the intentions that we are looking for. Probably they need to be, I think the need-based analysis and the evidence-based research has to be done in the community, whether that implementation is going on. So the response is, of course, what we hear is good from the communities. The education is basic, so it's the key to give them awareness and to respond and to act in the communities. Those are the victims. The other thing is involving men and women, especially men, because I would perceive involving men or women issue can reduce those problems, because most of the time we see like domestic violence. Women are the activists. Women, I'm victimized. That's what they say. But men has to come out and say, "Oh, this is wrong. This is wrongdoing."
Yeah.
The same thing for FGM. One of the reasons why FGM is being done is they perceive it that if they do it, they can get a husband.
Yeah.
That's one perception. So if men come out and they say, "Oh, I don't want girls who are circumcised or genitally cut. I need originally created women to get married," probably that will stop. Yeah. They will say, "Oh, if I cut my girls, she will not get a husband."
Yeah.
So that's, I think, that way of approach is good.
Mr. Yirga wanted it to be clear that women should not be stigmatized or punished for a procedure that they did not choose. Women and men must take a stand to say that this procedure is no longer necessary in a cultural context, and only then will FGM end.
So,
and is that part of the public campaign that are you a part of anything that's saying say no to, or for the men?
I'm trying to create my own website to at least to share that, since we are using in a social media same time, so it's easier for us to reach them. I mean, I'll try to create a website. That's what I'm planning next.
Yeah.
So designing a web page so that our web page is mainly focusing on male, so no to FGM. So maybe I was thinking about it, and probably I don't know yet, but it's gonna come soon. That's my plan. Yeah, to work with other people who are working with men's.
Yeah.
So that's my plan.
I think that's great.
Yes. So it's gonna be, I think, come through. Yeah.
If there's anything else that you'd like to address or talk about.
Yeah, I would say thank you for inviting me. I mean, this is actually a very, very interesting thing to reach out communities, so that if they are actually, like, let's say, if the topic is like confusing, sometimes, here in the United States, people are like, what? They say if you present like things, because it's not a practice here. So actually creating awareness, even for health professionals. Some of them, they don't know what FGM, or female genital mutilation, and some of them, they say the term is not good to use it, but we have to use it. Yeah.
That's what it is.
They say, last time when we had a discussion, they say, instead of saying mutilation, we have to say cutting. For me, it doesn't make any difference. So starting from using terms, openly discussing, whenever there is a community gathering or meetings, people has to go there and try to speak all those ideas and points. Apart from that, planning to work especially in the US. So I presented from the practice perspective, overviews and countries. Now focusing on working on the US soil, what's going on and how to tackle this problem. So I hope everybody will contribute on that, and will reduce and will stop domestic violence as well as female genital mutilation in the world. Okay. Yeah, that's all I can say. Yeah.
Thank you so much for the interview.
Thank you so much. Thank you.
This song is sung by a group called Yirga. They're Ethiopians singing for the girls. The song is Sedet, Migration. Yirga is an all-Ethiopian girl group that reaches out to empower young It's the online piece to the British daily newspaper. It's entitled Facts You Should Know About Female Genital Mutilation.